Hello everyone, my name is Virginia Beckloff and today I will be discussing eating disorders in adolescents and the effect our growing obesity problem has had on who we diagnose with an eating disorder. Let's begin with some general information. Eating disorders are the third most chronic condition in adolescents after obesity and asthma. Onset is early, among children as young as 5 and up to 12 years old. From 1999 to 2006, hospitalizations for eating disorders increased 119% for children younger than 12 years old. The most diagnosed eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa is characterized by the restriction of food in hopes of losing weight. The patient can suffer from body image distortion or fear of gaining weight. Bulimia nervosa is characterized by a cycle of binging and compensatory behavior such as vomiting or the use of diuretics. Binge eating disorder is like bulimia, where recurrent episodes of large amounts of food are eaten in a short period of time, but there are no compensatory efforts afterward. Today I want to discuss and focus on anorexia and the place obesity has in the diagnosis. The peak age for onset of anorexia is mid-adolescence, with the highest prevalence found in girls. Most adolescents who develop anorexia were not previously overweight, but it is not uncommon to fall into an eating disorder in the hopes of trying to eat healthy. In one study, 36.7% of adolescents seeking treatment had previous weight greater than the 85th percentile for age and sex, putting them in the obesity range. But how does this happen? Over the past 30 years, the rate of childhood obesity has more than quadrupled and only slowed to a steady rate in the past few years. Atypical anorexia nervosa is the new terminology used for those who fail to meet the criteria for weight of anorexia but fulfill other parts of the diagnosis. Misinterpretations of what is healthy and what is not have led some adolescents to start dietary restrictions, skipping meals, and periods of starvation. In cross-sectional studies, overweight individuals have been shown to more likely partake in these activities than normal weight peers. Eating disorders that develop in the context of previous obesity can present challenges with diagnosis. Families will praise weight loss in the beginning, but when the preoccupation with weight loss takes the lead over friends, causes isolation, irritability, or difficulty focusing, a disorder might have cultivated. Focusing only on weight loss can miss the symptoms concerning an eating disorder and the underlying cause. Some management strategies in the prevention of an adolescent's getting an eating disorder can be started early and both by parents and pediatricians. Dieting. Avoid the use of this word around young children and focus on healthy eating. Put the importance in other places because the use of this restricting of calories has only been found to increase the likelihood of eating disorders in children and years later as they grow into adults. Family meals. Parents have an enormous opportunity to model good dietary quality and increased intake of fruits, vegetables, grains, and whole foods. Family meals are also a good place to monitor a child's food intake and be aware of any changes he or she has made. Weight talk. Family members, especially parents, need to be aware of what they say around and to their children. Children are found to be greatly influenced by negative self-talk of parents, and by learning to keep conversations about healthy living behaviors and positive body image have been found to decrease the chances of an adolescent partaking in disordered eating behaviors. Approximately half of teenage girls and a quarter of teenage boys are dissatisfied with their bodies, and body dissatisfaction is a known risk factor for eating disorders like anorexia nervosa. So where can you start? Here I have listed a national and local organization that deal with eating disorders. Eating recovery centers provide comprehensive treatment for families and individuals with integrated healthcare systems for lifelong recovery. Locally, the Oklahoma Eating Disorder Association is a nonprofit dedicated to the prevention and treatment of eating disorders. They can provide guidance and places parents can go to seek treatment. A good idea for parents is learning tips and how to raise children in a healthy eating environment. HealthyChildren.org provides information about different life stages of nutrition and other resources. The best advice I can give a parent about eating disorders is to focus on prevention. Model what you want to see in your kids, and if you do find your child suffering, do not hesitate to seek help. Thank you.